Well, hello, family and friends. This is episode 63 of the Stand Up with Pete Dominick podcast, and we are now living under a declaration of national emergency as a viral outbreak, a pandemic, has swept the nation and the globe with fear, panic, anxiety, death, illness, and crushing economic consequences. So, how are you doing? Today, I welcome two experts perfectly equipped to talk about your health and your wealth. So, let's do it. I want to open today's show by thanking all the amazing new folks who have signed up for paid subscriptions on Patreon. Friday and throughout the weekend, my wife and I got notified that we have, at least temporarily, basically lost our ability to earn an income. At least outside of what I'm doing here on the podcast. We're both independent contractors. Neither one of us has a salaried job. My wife is a health coach and personal trainer and yoga teacher. All of her clients and classes have canceled. I tweeted it yesterday. I said, well, that's it. All gigs for the next 2 months are canceled. All my gigs. And Val has lost all of her classes and clients for the foreseeable future. We'll be relying on this podcast for income. And I will be posting new content every day from the best experts in the country, my conversations and questions for them, as well as everywhere else on social media. And guess what? Over 20 new people signed up at patreon.com/Pete Dominick. A whole bunch of others raised their subscriptions up. So it actually made for a pretty inspiring Sunday. I'm not asking for charity. I'm planning on earning your money. This is independent media. I answer to you. You are a producer of this show. And you, as Anderson Cooper likes to say kind of douchily, are keeping me honest. I hope to hear from you. I want to continue giving shout-outs. Last two episodes, I thanked the first 10 subscribers who signed up back in early November. Let me give shout-outs to the next 5 who signed up. Trip Longest, paying $10 a month. Joe Dennis, $5. Larry Sakurai, $5. Andrew Feldman, $5. Subscription to Matthew Price, also paying $5. Thank you, Trip, Joe, Larry, Andrew, and Matthew. It is greatly appreciated. Yesterday, I shared a morning idea, and I'll try to every day on Twitter say something positive, sharing ideas. We're all sheltering at home. And for parents with kids and everyone else, if you have activity ideas, please share them. I tweeted this out yesterday and shared it on Instagram and Facebook. I said, consider starting some seeds under lights. Plant some tomatoes and some basil and get some lights to help them grow and water them. It's a really fun thing to do with your kid. On Twitter, Jet said puzzles, puzzles, and more puzzles. Others answering my hashtag family activity ideas. Kim and I said we made family trees yesterday. We got as far as we could remember. Now we called my mother-in-law on lockdown at her assisted living facility to fill in the blanks, as well as my grandmother. A 4-year-old is also coloring pictures to send to grandma and all of her friends. Hashtag family activity ideas. Send me yours. Scotty Bizzle wrote, we introduced our 13-year-old daughter to some of our favorite 80s and 90s movies last night, like Can't Buy Me Love, Say Anything, and Reality Bites. Karen Pritchett said virtual tours of museums, acting out scenes from books, hide and seek indoors. Go to scholastic.com for board games, baking, reinforced measuring, and follow directions. Create When I Grow Up collage, clean out and organize backpacks and folders. Wow, Karen, you guys were busy. Gary Weissenfluh. He says scavenger hunts in the backyard. They love it. Cheryl says read and have book reports. There are a lot of free educational games online. Do a home project, write a diary entry, make a play, have an exercise routine, menus for the week, take virtual tours, communicate with teaching on digital learning. And finally, Claudia said for hashtag family activity ideas, marathon board games, break out the Monopoly. Also wanted to share before I get to my conversation with Barry Ritholtz, this other post I saw by Kay Bruner. By Rebecca Reynolds. Here's an excellent checklist from Rebecca Reynolds for being a helper in the midst of a pandemic. Number 1, you can just check these off. I've checked on one local elderly friend to let him or her know that I'm willing to make a grocery run now to keep him or her out of crowds and offer assistance if needed as the virus passes through my town. Number 2, I've donated to a local organization that stands ready to help the helpless in my community if a crisis escalates locally. Number 3, I've donated to an international organization that cares for orphans in a country in which COVID-19 has run rampant. Number 4, I've contacted at least one out-of-town friend to ask if he or she needs me to mail any sorts of supplies that are available in my area. 5, I've reached out to at least one family with an immune-compromised member to let them know I'm praying and see if I can run out to buy groceries for them as the virus passes. Praying? Okay, whatever. Number 6, I've evaluated my own motives, preparation, and behavior to make sure I'm not likely to add complexity to my community resources. Number 7, I've continued to invest in my local and national economy. I saw people saying buy gift cards now from local restaurants, etc., because they'll need the money now, and you'll get whatever you want later. Number 8, I've found ways to resist fear-based racism in my daily conversation about the virus. And number 9, I've expressed gratitude and respect for at least one public official who is walking into the face of the virus. Police, 9/11 operators, firefighters, doctors, nurses. Yeah, I'd give it an extra shout-out to truckers and anybody working, restocking the grocery stores, all for the good of others. So that's a cool checklist. I've shared that in the show notes, as well as links to my guests, the Patreon, and more. Let's get now to bioethicist from NYU Langone Medical Center, who I asked a whole bunch of tough questions to. My conversation now with Dr. Arthur Caplan. All right, I'm very excited to have one of the most brilliant bioethicists in the world joining me from his home. He is at NYU Langone. He is Dr. Arthur Caplan. Thank you, as always, for joining me in conversation. So much that we have to learn from you. First of all, how do you feel about the fact that I'm having 12-year-olds over today to have a snuggle party? Is that a good idea or a bad idea?
Bad idea. Probably wasn't bad. It was probably a bad idea before the coronavirus thing.
Fair enough. Wow.
Still a bad idea. So I know people they got the kids home, a lot of them. They're isolating, and the temptation is invite some folks over. I would try not to do that over the next week or two. Let them talk to each other online, let them text each other, that sort of thing. But really, having a bunch of kids come over to play, and they do touch each other, and then they go back, and then their relatives are in there, and it undercuts a little bit the idea of the social isolation. So I'll just put it this way. The more you can hold out without extreme dementia setting in, the better.
No kids should come over to my house. My kids shouldn't go to their houses. Can they?
Right now, no. Right now, no.
What is your week time frame that you just mentioned about?
I think what we're going to see is this week and next week an escalation in the number of cases. We're going to know really a lot more about who's infected and who's really at risk. So that virus takes 5 or 6 days to incubate and show symptoms. If your kid's friend came over from a house where somebody was infected, we wouldn't necessarily see it yet, but if they get tested because they're in an at-risk group, now we're going to know that their kid's at risk. You didn't want them to come over. It's that sort of thing. So let the testing go on a little bit. If you know that the parents, everybody who's living in the home where the kid is, all tested negative because they were, worried that they were an at-risk group, then we start to relax all that and say, okay, some socializing. Nice to play outdoors, by the way, not indoors.
Exactly. And the weather's gotten at least cooperating a little bit here in these first couple of days. It'd be that much worse.
You followed that, right? So it's the reason you don't want the kids coming over is not just that the kid, you're worried about them being infected, but the parents or the grandmom or somebody may be infected. They infected the kid. They're not going to show it in themselves for, say, 4 to 5 days. Then the kid won't show it for 4 to 5 days. So you're just trying to get ahead of that. Let's call it a week window.
Right. So my wife, very generous friend, was bringing her on vacation to Mexico this Thursday. Should she go, Dr. Caplan?
No, I don't think so. I had a trip. Believe it or not, I know this will be hard for many viewers to believe, but I'm 70, and I had a 70th birthday party, Maui. I mean, nice gig.
Why?
Canceled it.
Well, that's why I invited you on today. I knew that happened, and this whole interview is a surprise party for your 70th. All right, everybody, come on in. All of your friends came to my house, and we're all going to be in my tiny studio. Do you suggest that your friends keep social distance in this studio? What about socializing?
Well, tell them not to high-five each other. How's that?
just elbow bumps and foot.
Elbow bump.
So,
by the way, can we believe that the president continues to shake hands, continues not to show his hand sanitizer when he's wandering around, which would be a nice thing to do? He continues to hang around with people who are known to be infected. I mean, what kind of role model is this?
I'm going to stump you for the first time ever. This isn't a bioethics question per se, but what behavior has Donald Trump ever role modeled that's a behavior that is appropriate that folks should follow? Sir?
Taking a nap, which he seems to take extraordinary numbers of for long periods of time, but it's not a bad practice.
I thought the Surgeon General said he doesn't sleep very much.
Well, we can't model our behavior on him. He's a paragon of vigor and health. So
a lot of young people seemingly, I guess there's this idea that they're invincible because they're in their 20s. Maybe they're not paying attention to news. But this weekend, people were outraged that young people were out at bars and restaurants. We're taping this Sunday morning where there's a line out the door for brunch in certain places and cities. What about going to bars and restaurants and hanging out and socializing in places like that?
No bars. Don't stay in the restaurant. Do take out. Get it delivered. We're kind of in that crucial period again, Pete, where testing is beginning to appear. We'll know better who to isolate, who actually is infected. Let the next 2 weeks, let us figure out who's actually the real risk groups. And, they'll know that they have to stay home, and then the rest of us can wander around a little bit more. But right now, I'll take out. I wouldn't be going to the pub, the club. I wouldn't be eating my meals in the restaurant. Obviously, some people rely on restaurants, and the restaurants, we need them. They feed a lot of people around the New York area in particular. So those, I think it's good for Seamless and Grubhub and Uber Eats and all those places.
Yeah. Tip your delivery guys, usually guys, extra. What about the schools, the school closings? This is a simple issue for those of us that have means, that have food. It is a much more difficult issue for those living with much fewer resources, those who have to go to work, parents. I think it's hard for most people to understand how difficult it's going to be for folks living on the lower end of the socioeconomic ladder. Explain why this is such a controversial thing in New York City and in other places, whether or not there's closing schools.
Yeah, school closures, which our mayor has been fighting because he knows if you close the schools, parents stay home. Now, we've just said 18 times that we want people to stay home, except there are some people we don't want to stay home. Nurses. Got to have the healthcare workforce coming in. If they don't have child help, we get a crisis because we're not sure who's going to be able to step in and help them out. That would have been preparedness planning to say, we do have some place they can go, which is safe, which we're going to keep them, isolated from one another, or to have social distancing or whatever it is, but we haven't planned for that. If you're homeless, I took a look at a shelter picture just from this week was actually in New York, but it could be anywhere. There's no place to send the kids back that they're isolated. They're sitting on top of one another in there. Again, no planning to try and space out a little bit. The shelters distribute people more broadly, that sort of thing. It's not that everybody can't cope when the kids come home. Some of the kids will probably die when they drive their parents crazy, not from the flu. But
yeah.
There are subgroups where you really want to pay attention and say, we've got to help them out. We got to send some help in there, somebody to look in on the older kids because their parents won't go to work. And if they're doctors, techs, phlebotomists to do blood tests, nurses, you don't want them staying home because they don't have anybody to be with the young kids.
Dr. Caplan, explain how woefully unprepared America's healthcare system is for this and welfare system or social safety net compared to some of the other European countries or even Asian countries that we've seen, Australia too.
Yeah, sadly, every rip in our social safety net just widens up to a gigantic tear when you have a pandemic. And what I mean is, if you have, let's say, uninsured people, and we got lots of them, even with our current programs, there's still many, they may say, I don't know, I can't afford to go into the doctor. I can't afford an emergency room visit. I'm going to stay away and I'm just not going in. They become obviously sources of infection, and they could hurt and kill themselves. We have people who also face big copays. Yeah, they have insurance, but it's crummy insurance. So they're worried about getting a test or coming into the healthcare system. Got a fair number of people who are undocumented, right? People who are here without papers, who've never solved the immigration problem. Every time the president gets near healthcare, he says, I don't care about those people. Remember, He said he wasn't going to give them flu shots.
Right.
Is he not going to give them coronavirus shots? Well, one thing we could do is, where is the amnesty, and say, hey, if you feel sick, come on into the doctor. We're not going to deport you. We'll wait a year and figure out what to do. He's still babbling on about a wall, which viruses don't care about, but it might be nice to encourage people to use the healthcare system without fear. Last group, you've got a lot of folks out there on the hospital side who just aren't trained and ready to deal with what to do when there's a breakout. It took too long for us, for example, to shut down the nursing homes. They're obviously full of people at risk. They can communicate the virus easily within the institution. We saw that out in Washington State. So we should have had those nursing homes blocking visitors, starting to bring meals to people in their rooms instead of having them eat together, weeks ago. Too slow on the response. And while we don't think of nursing homes as part of the healthcare system, they're an essential part of the healthcare system.
For sure. What about the testing? We have seen this drive-through testing in South Korea. I believe that I read yesterday that South Korea and the United States both reported in the same day, and maybe is it far back as January, the first case of COVID-19 in our respective countries. They had a different response in terms of testing than we have. They immediately ramped up these drive-through testing, which apparently was a plan that they, it's not like they're making it up on the fly. And here in the U.S., Jared Kushner is punching himself in his own face.
Jared Kushner, again, leading the charge. This time, if he's not getting in the Middle East, he's going to solve plagues. Well, he's a talented guy. I don't know, maybe. Anyway, South Korea clearly was ready to ramp up, partly because they had rules in place that let them go fast in producing the test kits. We wound up having an incredibly ridiculous bureaucratic fight where initially our CDC said the protocol for tests is you have to send tests for coronavirus to Atlanta from wherever you do the test. Are you kidding me? It's not like there aren't qualified labs all over the country that could do this. That was just the protocol. And they didn't waive it quickly. We had companies who wanted to start making kits. FDA said, well, unless they're certified and you prove them according to the usual rules, no good. Makes no sense. These tests aren't that dangerous. You'd even take a little bit of inaccuracy that you might not accept in normal times just to get them out there. That's a gigantic screw up. And I blame the White House not being all over this, and I blame the CDC and the FDA for being too bureaucratic.
Is there anything that you can see, and many of us have learned about this idea of flattening the curve? We've got to try to bring down the number of cases so that they don't inundate hospitals all over our country, and so that doctors don't have to decide this nightmare situation, who lives and who dies. And so, well, first of all, let me just ask you about that. You're the bioethicist. The situation that doctors and physicians have found themselves in Italy and probably in other countries, maybe Iran as well, is just that, right? That's what we're reading. Right. They're having to choose who lives and who dies. How is that seen in your field of bioethics?
Well, sadly, it's not an unknown problem. For example, Pete, every day there aren't enough organs to give out for transplant. People have to make decisions who's going to live and who's going to die. It happens every single day. Occasionally in the flu season, you get overrun in a particular hospital with flu patients. You got to shut the ER down. You're diverting them elsewhere. During the diversion, some of them are going to die because they're not getting care right away. And we know, there could be a bombing, a train accident, a building can blow up. So there are occasionally times where there's a big rush onto services and you got to make choices. So it's not unknown. I don't mean that it makes it easier, but it does exist within our system too. I think the answer is the Italians apparently said they're going to do young people first, end of story. I don't think that's right. What we try to do here is who's most likely to benefit as the driving rule about allocating a scarce resource. So a very sick, a young person with terrible injuries, even a terminal illness, they might not get access to a bed or a respirator at the same way that an older person who's very healthy might. So you get a healthy 60-year-old, you get a 25-year-old who's got some brain tumor. We're not putting that person first with a tumor, even if they're 25. So what I mean is we try to use a little bit of utilitarian thinking and say we got scarce resources. How do we save the most lives? And you know who makes that call? It's the doc in the hospital. You can have all the rules you want. You can have committees. We could put you and me on Zoom and have them, call us whenever it happens too fast. They're sort of there like bang, 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 got to decide this, move this guy out, put this guy on. So they have to understand what the rules are. And I'm pretty sure they do. That's an area that I'm not so worried about.
Do they, and will we have to make those decisions based on what? The age of the patient, the likelihood of their survival based on other conditions? I mean, if you've got grandpa over here and he's got some kind of respiratory issue, and then you've got a child, God forbid, we haven't seen it manifest too badly in children, or a younger, healthier person. I mean, what is the criteria?
So here's how you think it through. You first do your medical workup and you say, there's Art. What's he got? He seems to be in respiratory failure and he has underlying diabetes. He seems to have hypertension. He's been in with 3 previous heart operations. There's Pete. He has respiratory problems, but we don't see anything else with him. It's just he got the virus, but he has no obvious other medical problems. So the points are stacking up against Art, not just because he's older, but because he's sicker. And so the likelihood of responding to the ventilator, to the care that we know you need if you have pneumonia and a very bad lung infection is less. If you still have more people and they're all coming out tied, so to speak, then you're probably going to do first come, first serve. If it's Pete, Pete's brother, Pete's wife, they all have respiratory problems, but no other medical things that would let you sort them out, then you're probably going to go first come, first serve. There's a little bit of evidence, by the way, that men don't do quite as well as women with this. That could become a criteria to put your wife before you, other things being equal. So again, you can hear me. I'm trying to think efficacy. What's going to work? What's the most likely chance of making this scarce resource save somebody?
Is there an ethical choice or decision with, I hear the way that you actually die is pretty horrific, like drowning, basically, respiratory, just having a hard time breathing. Is there an ethical solution to alleviate the pain and suffering of someone that is at the end stages of this?
Yes. 2 things. One, I know it's horrible to say, but renew that conversation with your loved ones about what you want. If you're really spiraling out, it's important they know, don't pound on Pete, don't give Art the max thing, let him go. If it looks like he's really, really suffering and the odds of anything happening are tiny, let him go. So have that conversation. We have plenty of time. We're all at home. You can enjoy Netflix and talk about dying at the same time. What an opportunity. And then I think it's important to realize we do have morphine. We do have drugs. We can take care of you if you really get into terrible suffering. Right. A little nervous that because of the opioid crisis, there might be a little reluctance to use them, but hopefully, we can overcome that in the face of a gruesome death.
All right. Final question. What are you seeing and predicting? You replied to a tweet of mine yesterday about get ready for 30 to 60 days of isolation. What are you seeing happening in the next 7 days to 2 weeks?
I'm afraid we're going to see cases zoom up. They're really going to be a lot more because the testing is going up. And we've had some time now for the virus, if you will, to be percolating along without symptoms. And I think some people will start to show sickness. When those numbers begin to rise next week or the week after, don't freak out. It's only that we're seeing what was there. We're not getting more infections. It's just that the ones that were out there, we didn't know it because we never got on the ball with the testing. But I worry we're going to see a lot of anxiety and panic. It's back to the supermarket. I'm buying some more toilet paper. There's no reason to freak out about those supplies, by the way. They're still going to be in the grocery stores, and we're not going to close the grocery stores down. So I wouldn't go crazy that way. The reason I say 30 days is when you see the numbers begin to bump up and we get more infection, then we're going to know who has to be isolated. And I think it's going to take another couple of weeks to sort of let that all pass. sad news. Not sure this virus is going away. We may get to the point where we say it's at a low level. We're going to let everybody back out. We're going to let everybody go back to school or have some sports or whatever. But I have a feeling we're in a new era now until we get a vaccine, until we get a drug that cures it. I think we are going to be practicing more hand hygiene and, some social distancing and protecting the elderly in nursing homes. I'm going to say for the year.
If I'm single, I have to date for 2 weeks before touching.
That is correct.
And even then, how do you know? Like during that 2 week period, it's not like you were isolated that whole time. You could contract it. It's like even sexual contact. I mean, how about just sex without kissing?
Has anybody checked out the numbers on Pornhub this week?
Oh, I'm sure. I'm trying to think of industries that are doing well during this time. And yeah, porn would be a really good one.
Yeah, invest there. Don't hoard your sanitizer to sell it online. Buy a stock and whatever that is.
All right, pal. I thank you very much for your time today, and I'll be looking to you. Follow him on Twitter at Arthur Caplan, and that's all here on the screen and in the show notes if you're watching on the video. Thank you, sir. Appreciate it as always.
Thank you.
All right, there you go. That was a fun, difficult, scary conversation with Dr. Arthur Caplan. Follow him on Twitter at Arthur Caplan. Get his books. Tell him you heard him here on the show. And we go from your health to your wealth, ladies and gentlemen. Now I want to welcome back to the conversation Barry Ritholtz. At Ritholtz, everybody. We talked on Friday, so some of this information is already a little bit dated. The Fed hadn't lowered the interest rates and a couple of other things. More cities are on lockdown and towns have closed and stores have closed and so on. But yet I think this conversation is still really relevant and interesting and fun. A little funny at times as well. Here now, another conversation with the man when it comes to economics and finance. For your wealth now, let's go to at Ritholtz, everybody. Could you stand, straddle and maybe ride the router so that we get the best connection? Could you stick the router in the antenna in your ass?
I was going to say, I could use it as a... I love the first Jim Jeffries stand-up HBO video that was recorded at NYU, where he talks about pretty much doing that. It's hilarious. So now I'm literally 3 feet from the route.
Biggity row. We're here with Ritholtz, everybody. Thanks for tuning in. Barry Ritholtz. He's got the Big Picture blog, which everybody loves. Very popular blog. You've been writing in that blog for how long?
Since the early 1800s.
I want to talk
right after the Civil War. I launched it.
And are you holed up in your Long Island home right now? Can I say that to people?
We are socially distancing. My wife is just getting over a viral infection, which has her concerned about some immunocompromises. I don't know for sure if it's one way or another, but better safe than sorry. We gave everybody at Ritholtz Wealth Management the option of working from home Sunday night. Said, hey, you guys want to come in? Come in if you want to work from home. Whatever you're most comfortable with. Monday, we had 1 or 2 people who literally had serious immunocompromises in the household that stayed home. Tuesday, a few more. By Tuesday afternoon, it was clear everything was shutting down, and we re-emphasized people, hey, you don't be a hero. The 20-somethings, not only are they immortal generally, but for this particular flavor of coronavirus, the COVID-19, it seems that the younger you are, the better you are. So old folks like you and me, Pete, we have to be a little more cautious.
Well, I wouldn't put me in your category. I mean, I'm younger and in better shape. So
I have much better hair.
That's true.
That is really all that
Remember
matters.
the time I was at your house and we went in your pool and you challenged me to a race and you beat me?
You were so mortified that
Still
you
am.
lost.
Still am.
It was hilarious.
I want another shot at the title.
The secret is fat is a great flotation device. You sink deeper into the water, I get to skim along the surface.
Yeah. Not only that, you shaved your entire body right before we jumped in, which I thought was weird.
When I was on track, people used to say to me, this was before it was common for athletes to shave. They would say, you shave your body? No, I'm just a hairless variant.
Yeah.
It's a Darwinian advantage.
Yes.
I'm much more aerodynamic than you.
You have the body of a baby hamster. Okay. Sorry, we're closed is the title of the blog that I wanted to talk with you about, entry, and probably more than just this entry. But you talk about, you open this, you say the nation has essentially shut down. Let's first of all just, I don't know, things are developing minute to minute. But when you look, I feel like the baseline, Ritholtz, is Italy right now, where everything is shut down but grocery stores or food markets and drugstores. Everything else is shut down. That's the baseline. Are we headed there?
Well, we're certainly not there yet. But depending on how rapidly, this is the big unknown. This is the big variable. We really don't know how many people are infected in the United States because we so badly are lagging behind other countries in testing. We've barely tested 10,000 people nationwide. South Korea, since this began months ago, South Korea is testing 10,000 people a day. A day. What we've done in 4 months, they do each day. We are way behind. This was a very ham-handed response by the White House, by this administration. It's too easy to bash Trump and him being inept and incompetent, but truly, this is finally coming home. This is going to be the event that, unfortunately, is going to get potentially so bad that it reveals how incompetent the president is. Remember, in 2018, anything that Obama did, he wanted to undo. He fired the entire pandemic preparation group in the CDC. This was 2018. This is not a deep state conspiracy theory. This is a Washington Post headline 2 years ago. The people who would have been making sure there are enough hospital beds, making sure there are enough tests, making sure that various pharmaceutical companies were working on a vaccine and a if not a cure, something like a Theraflu to help through it. That whole group was fired, and the only explanation for that is because Obama set it up. It must be bad, and therefore we're getting rid of it. That is a giant snafu, and we are paying the penalty for that.
We can talk about the president and his ineptitude. And frankly, what I think is the more important point, seriously, and I've been saying this everywhere I can, he doesn't care about us. He doesn't care about anybody, not his own family, much less the United States public. I mean,
my numbers. He cares about my numbers. We can't bring the cruise ship here.
Right. And he also
how revealing was that about his narcissism and lack of empathy?
Well, I mean, I'm not sure that we needed to see that. We've been seeing that his entire career, long before he became president. But what about the other, leaving the president and his administration aside, what about just the simple point that the United States healthcare system is woefully unprepared? We don't have universal health insurance, and we don't have paid sick leave, and we put profit over people, so we don't have a whole bunch of extra beds and ventilators because that would cost more money. I mean, just looking at our underlying system versus the rest of the world, aren't we woefully unprepared just because of that?
Yes, we're understaffed medically. If you look at the chart, I may have sent this to you on Wednesday. I just gathered a bunch of charts that I thought were kind of interesting about the virus and about the U.S. preparation. And this is something that goes back way before Trump. We have far fewer nurses per capita and doctors per capita as a function of our medical system and as a function of a lack of universal coverage. So there are literally less healthcare workers. There's less beds. Many of our hospitals that used to be nonprofits have become for-profit companies. And even the hospitals that are nonprofit in name have been changed to, if not act just like for-profit hospitals, they very much have a for-profit behavior that is somewhat shocking. And so how does that manifest itself? Well, no capital spending on things that aren't immediately needed. Why should we have ventilators? Why should we have beds? Why should we have emergency preparation plans if we're not going to get paid for it? Hospitals are supposed to be a community service. Making them part of the for-profit sector has great potential damage in times of stress.
Right.
And a pandemic is that sort of time of stress.
All right. So you also talk about the difference between the financial crisis of 2002, 7, and 8, which you wrote an entire book about, Bailout Nation. Everybody should get and read that book. It's still super relevant. The difference here is it's not an economic issue as much as it is. I mean, it is. But you write the danger this time is an externality. What's the difference between financial and biological?
Sure. Well, when you have a financial crisis, the policy response comes with all sorts of financial prescriptions. So during the financial crisis, the credit markets froze. All the securitized debts, primarily mortgages, but also derivatives, all of that stuff sort of ground to a halt. The system began to seize, like a car engine whose oil had leaked out and it overheated and seized. So the solution to that was what the Fed did, which was you inject lots of liquidity into the system, even if it's temporary. You lower interest rates. You create all sorts of lending facilities, interbank lending, et cetera. And so you get the sand out of the gears and you get the financial engine to start moving again, to mix my various metaphors. This is not that problem, although we have seen some odd structural issues over the past couple of years, volatility notes and overnight repos, which is repurchase agreements where banks are lending money back and forth. It's nothing like 0809, and it's not a systemic. What we actually have now is something quite simple. It's a highly infectious virus with a higher than average mortality rate compared to the other. So coronaviruses are a classification of virus. It includes the influenza. It includes the common cold. It includes all these things. This seems to be something that is a trans-species virus. What I've read, it jumped from one species to another.
Yeah, it came from animals to humans. Although, don't let the conspiracy theorists be belied by that. Is that a word?
Yes, it is. But what makes this interesting is we don't have any natural antibodies to this. It tends to be more infectious than regular flus, and it tends to have a higher mortality rate. So this is a very significant healthcare threat that is outside of the financial system. It didn't originate. It's not subprime mortgages. It's not, like the October 87 crash. It's not inflation. It's outside of the financial system, which in many ways is good because those are a little easier to deal with financially. And so when we see something like this, the response of the public is to self-evaluate and say, hey, am I potentially at risk? Am I potentially a person who could not only catch this but have a bad effect? Now, keep in mind, from what we've seen, 80% of the people who get this, especially those under 60, get mild symptoms. It's not a bad thing, and a week or so later, they're better. Time lengths vary. Right. All these things vary. I don't want to speak in too specific, but it's so. What do you do if you have asthma or respiratory ailments or any sort of? There are all sorts of drugs that operate as an immunosuppressant depending on various diseases.
Yeah, one of the issues is we get a lot of drugs from other countries like China.
Right. So that's an even more complicated issue that again, this comes back to national security and having better industrial policy. There are certain things that we should make here regardless. Right. That I think, again, I don't want to go back to the president, all the let's build this stuff here. The way to approach that is from a national security standpoint, not from a we want made in America regardless of what's best for the companies that make it. But with certain things like, we don't outsource our military manufacturing, right? Because it becomes a national security issue.
Well, this is too. So are antibiotics, and most of them are not made here, right? And I think ibuprofen and obviously and a bunch of other ideas. I don't know where ventilators are made, but I hope that they ramp those up. So
these are things that should be made in the United States,
so let's
or at least have the capacity to ramp up production rapidly in the United States.
You have a really good list of suspended or closed economic activities, from the airlines to school districts and colleges to sports leagues and live performance, to Disney World and Disneyland, the festivals and so on.
I tried really hard not to make that super New York centric.
Right.
I know I live in a bubble, as most of us here do. So things like Broadway closings and the Madison Square Garden and the Metropolitan Museum of Art and all those things. It's just an example of New York as a tourist town. But then, as well as all the late night shows, Colbert, John Oliver, Jimmy Fallon, they're all shot here. Samantha Bee, Trevor Noah. I tried to include things like Disney World and Disneyland are closed. Various talk shows in LA and New York are shooting without.
Yeah. Don't I know it? I was supposed to be the audience warm-up comedian at John Oliver in a couple weeks.
Yeah.
And
I saw that and I immediately thought of you that was closed.
I mean, every comedian is completely screwed. Every comedy club, every waiter and bartender.
I put that down. Concerts, comedy clubs.
Yep.
France closed all its schools. Various states and school districts in the U.S. are closing. All sorts of colleges are sending their kids home for the rest of the semester and saying students attend classes virtually.
So what does it mean? What does it mean economically? I mean, that's what you spell out in this. I want to get to that.
So now let's get to this.
This whole quarter, much less year, is screwed. What kind of recession are we talking about? And what, most importantly, you have suggestions and ideas, should be the government response?
So economically, the range of forecasts are all over the place. And the problem with all the forecasts are they're highly dependent on two things. They're dependent on how bad this gets, and we don't know how bad it will get. There are some reasonable guesses and estimates. Some of them might be too aggressive. Maybe they're way underestimating. We don't know. You know, if you look at the SARS virus, which killed about 15,000 people, keep in mind the typical flu in the United States is 25 to 40,000 deaths a year. SARS was about 15,000 deaths. That infected 60 million people, right? So, by the way, they just canceled the Masters golf tournament. I mean, we're just going to see.
The one I'm least concerned with, but yet there are so many jobs surrounding that, so I shouldn't
be. It's not just the Tiger Woods or Phil Mickelson or whoever is the winner. I don't golf. I could care less about it.
The groundskeeper.
You look at the crowds. You look at all the people. You look at, South by Southwest was canceled. That's like a $400 million influx of economic activity. Think about everybody who works there, everybody who, the hotels, the taxi drivers, the restaurants, the bartenders. Just go down the list. The maids who work in the various hotels. Everybody who is associated with that is going to feel the pain from this. Whether a couple of airlines just laid off 50% of their staff. Norwegian just did a 50% staff layoff. American and United have cut like a third of their flights, with more flights coming. So you think about this, and maybe it's a slight exaggeration to say, sorry, we're closed. But the economic impact of this, the good news is it's temporary. When this is done, and historically pandemics last a certain period of time and then they are done, the economy will come snapping back. If anything, there will be pent-up demand, and the fourth quarter, I'm making up dates, will probably be much better than the first quarter. It won't be enough to make up for the second and third quarter shortfalls, but we'll come roaring back. I mean, I've been home for 3 days. I'm already dying to get out of the house. I already have cabin fever.
Well, yeah, I want to.
3 weeks and 3 months is a whole nother story.
Well, you don't have kids living there. You don't have, it's like, I'm fascinated right now by how we are going to handle this cognitively, psychologically, behaviorally, how we're going to talk to our children, how we're going to, and if we're going to rely on each other. It's the whole situation is completely unprecedented for anybody that's alive, right? Am I missing something there? Nobody has ever gone through this. And Americans have been uniquely privileged and set up, even those in lower income brackets to some extent, in terms of not having to overcome the type of adversity that people living in deep poverty in underdeveloped countries have. But so, and other countries are responding much better to this in a number of ways. Let's get to some of these solutions, though, that you're offering. And noted that I think the Canadians just passed or proposed a $1 billion fiscal stimulus. I've seen American policy economic $1 billion.
Billion.
Yeah, that's nothing. Yeah,
that's pocket change. That's think about $1 billion in an economy that's $18 trillion.
Well, that's Canada. Though. I'm talking about Canada. Is that
still?
Yeah.
So Canada's, what is Canada, like a tenth of our economy? They're 1.6 trillion, something like that. They are, and I'll look it up while we're talking. But
and your old keyboard.
Yeah, on my old keyboard. But when you think about I could do it on the iPad. It'll be quieter. It's just Canada GDP. You just punch in, and I'll get from the Google machine. It's 1.6 trillion US. I was pretty close when I said it's 10%. So I was guessing 1.8, so it's 1.65, but and that's 2017. So maybe it'll be.
So that's you're saying that's not enough of a response, fiscal response for Canada.
Tiny.
So what about what we can and should do? What are the ideas?
By the way, we did $8 billion. No one's going to notice $8 billion.
We did $8 billion when.
That was the proposal that went through the Senate. We passed in the Senate, and I don't believe it's been signed yet, an $8 billion stimulus response to this, which some of which was earmarked for CDC. It really was making up what was cut in 2018, which, of course, your preparation is always better before the event. Preparation after the event is kind of too late.
Right.
When the engine falls off the plane at 30,000 feet, probably not the time you want the captain flipping over that book saying what to do in an emergency situation.
So So obviously we need a much larger fiscal stimulus from government, but you tweeted at Ritholtz, if I were president of the United States, I would announce a massive $5 trillion 10-year infrastructure project paid for with 1% 100-year bonds. First of all, not why $5 trillion, not the pay for, but why a 10-year infrastructure project?
Well, anything you do with infrastructure is a much longer dated, longer term thing. To fix a bridge, to redo an airport, to repair a tunnel, to repave a highway system. That's not like do that on Tuesday and then you're done. That is something totally different. Alexa is annoying me, so let me shut her up.
What is she? Why is she? Is she warning you? She reminding you?
No, she's telling me that I probably got a delivery. Our hunker down process involved Target, the supermarket, Alexa, and the drugstore, which was basically I'm not a prepper, I'm not a survivalist, but I used to every month go to Target until I figured out how annoying that is. And I started, you've seen my basement, I have a ton of storage space. I basically started going once a quarter, and anything that's non-perishable, I would put, on the wire racks in the basement. So we said, let's just load ourselves up with a month's worth of crap, everything from nuts and cereal to tissues and toilet paper, and some additional cough syrup and Advil and stuff like that. And everything else that I needed for the dogs, I ordered from Amazon. So I got 3 months worth of dogs' food. So if this goes on for 3 months, I have enough stuff to do.
And what's your home address?
My home address is somewhere in Rockland County.
That's mine. How dare you? Okay, so
that's right.
So getting back to
by the way,
infrastructure,
I also looked into, and I don't want to get too crazy, but I looked into picking up like a 20 cubic foot freezer to leave in the garage and buy food like meat and chicken and stuff, so that if this goes on for months, we don't have to go out to the supermarket. And again, if my wife wasn't potentially compromised, I wouldn't be thinking of this. I think and I decided not to do it. I thought it was overkill. But that said, you have to imagine.
I went into a gun store yesterday.
You did?
I did. I walked in to see, because there's one right near. I'm not panicking and buying a gun, but I was like, I want to know. I went in there kind of almost like a journalist.
Were they busy?
Yeah. I said, how much, first of all, is it legal for me to just buy a shotgun and leave with it? And he's like, yep. And he goes, but we don't have any because we sold 7 today.
Wow.
Yeah.
Just get a Glock. You don't need anything more than that.
Well, that takes that's a more arduous background. That takes, I think, weeks to get approved for.
Yeah.
So
the shotgun is fast.
Shotgun, you can just yeah.
You know, it's hard to buy ammo in New York. My shooting buddies go to Pennsylvania.
Well, I wasn't planning on having any ammo. I just need it for the optics. So getting back, we
never point a gun at somebody unless you plan on shooting them.
Fair enough.
Seriously.
All right.
If you're going to point a gun at someone, you have to be prepared to kill them.
We've gotten off track with the infrastructure bond deal.
I'm just giving you some good gun advice.
Thank you.
Because if they manage to take the gun away from you, they'll just pistol whip you until you're an unhappy mess. So never bring a knife to a gunfight.
Yeah, that's not
never pull out a gun unless you're going to use it.
That's not how I want to go out. Getting beaten with my own pistol.
Right.
All right.
Because it was not loaded.
Exactly.
What are the optics of that?
That's a fair point.
You also don't know if the person opposite you has a gun, has a knife. You're escalating the battle, but it's like bluffing in poker. You have to be willing to lose the pot. Well, that's a bad bluff.
Clearly, you've thought this through.
You take any sort of gun training class. This is.
Yeah.
I've taken motorcycle riding classes. I've taken cooking classes. I like learning about things.
You certainly do, and that's why I love having you on the show. Okay, so getting back to the, were you done explaining your solution for infrastructure projects, the long term, and the pay for, which is a bond?
Right. So what that does is the problem that we're dealing with today is that there has been a massive decrease in demand. It's coming from the private sector. It's the household demand has dropped. It's the business demand that dropped. Business travel has fallen off a cliff. All these conferences and events and sales and all this stuff, it's done. That stuff is now on more or less on lockdown. Most companies I am familiar with, if you do not have to be in the office or travel, you are not going to travel. I'm shocked. My brother, who was in the pharmaceutical industry, was in Philly. It was Tuesday. It wasn't yesterday. And I'm like, what the hell are you doing traveling? Because this was scheduled months ago. I had to go. I'm like, I would have canceled. And Wednesday, he was, back home and said he was sorry he traveled. He regretted it.
Mm.
Now, going forward, with all these cancellations, there is a psychological impact on the public.
Yeah.
Big sentiment impact on business. Everybody is cutting back. The impact on the economy is going to be significant. The recovery, whenever it comes, is likely to be just as significant. But if you want to make up for this shortfall, if you want to stimulate the economy, when you want to do things short term, you do things like temporary tax cuts and extension of unemployment. And if it were up to me, I would make the coronavirus test free, let Medicare pay for it. And I would say if you are one of the, 35 million people without healthcare coverage, testing or treatment is free, again, covered by Medicare. If you don't do that, what you're basically doing is taking 35 million people and saying, okay, everybody, you're now Typhoid Mary. Go forth and spread the infection because we're not going to test, we're not going to treat, we're not going to quarantine you. Best of luck. And that's how you get 300 million people infected with that sort of stuff. Those are all short-term responses. The infrastructure response is long-term. That's something that not only do we need a good infrastructure response, but a good infrastructure build, but we also don't have any sort of funding for these things, and the bonds are how you pay for it. $5 trillion at 1% is practically free money, and all these new projects you can assign a certain percentage of tolls and things like that to pay back the bonds. And the country ends up with a economic advantage because they have a highly competitive infrastructure. By the way, that's a giant disadvantage that America has versus a lot of countries, especially in Asia. We have a second world, in some places a third world infrastructure.
And why is that such a disadvantage right now?
Well, if you want to build a office building or a factory, or the things like quality of life makes a big difference. And there are reasons why countries like the Netherlands, Denmark, and places like Switzerland and Austria rank so much higher than the U.S. on these quality of life surveys. And so when someone is trying to decide, do we build a new factory in Alabama or do we build it in Norway, very often we're losing to countries because the executives don't want to live there.
Yeah, but what is that? Are you making? You're making that as a general point that in terms of infrastructure, not in terms of. This is an overall point of our infrastructure needs to be repaired, and we need a massive stimulus to our economy. We have, by the way, for a long time.
It
doesn't have as much to do with the current state of things with the pandemic. It's just part of a larger solution that you think would work financially, economically.
The pandemic impact on the economy is a great excuse to do a decent sort of stimulus plan.
Right.
And the easiest stimulus plan and the one with the most bipartisan support is infrastructure.
Right. All right. What else before we go? You had another really good post about just behavior and the markets, and used a great anecdote or a scene from Apocalypse Now to explain, which I love, which is why I love talking to you and reading you, because you can make some of the more boring things kind of much more interesting. But you want to talk about that real quick?
Sure. So everybody is familiar.
What is the VIX telling us? VIX. That's the title of this post at Ritholtz, the big picture.
Right. The VIX is the volatility index, and it's a measure of, some people call it the fear measure. It kind of tells you, are people panicking? And by the way it's constructed is it just looks at the prices of various options on different broad market indices. And when those prices spike, it tends to be when people are looking to hedge positions, and they're doing so out of fear and panic. So that's why it's called the fear index. So I'm a big fan of Apocalypse Now. And in many ways, I think Robert Duvall is this supporting actor who his character is really kind of fascinating. And I actually linked to my favorite scene where him and his guys, after a assault, are now getting ready to surf the point.
Yeah.
Charlie, don't surf is the great line he has. And it's still hot. There's still, incoming shells and bullets whizzing by. And he gets angry that someone says it's still kind of hairy out there, and he basically calls in a napalm strike on the tree line, and everybody remembers the smell that smells like napalm, gasoline. I love the smell of napalm in the morning. Smells like victory. Everybody remembers that line, but they miss what is my favorite line at the end of Duvall's little soliloquy, which is he just looks at one of the soldiers and with this, it's an utter hellscape. It's like literally things are blowing up. By the way, they call in the strike. You see the I don't know what they are. They look like F-15s come in and just torch this run of trees, just a massive explosion. So after they call in this strike and Duvall gives this speech, he looks at a soldier and with this like knowing wistfulness says, someday this war is going to end. Like it's a bad thing. Like despite all the death and destruction around him, he knows, Lieutenant Kilgore knows that this sort of hot war is a once-in-a-lifetime opportunity. Just because you were drafted and you have to kill people or people are trying to kill you, that doesn't mean you shouldn't make the best of the situation. For him, that means surfing. And just because he's a psychopath doesn't mean he isn't right. And so I approached the great financial crisis in real time the same way as Lieutenant Kilgore. And I thought, and I said this to people, someday this market crash is going to end. It was a once-in-a-lifetime opportunity to see what people are doing, to observe traders in real time, to look at how clients responded, to watch the commentariat, to watch the pundits in the press. And it was, that was my postdoctoral work. That was my second graduate degree, to actually pay attention to what is going on and look at how everybody dealt with it and how everybody responded. And, someday this war is going to end means that someday we are not going to be in this classroom situation of learning amazing things about people and capital markets and governments and banks and everybody else. And so that's why I started this with the Apocalypse Now clip, because I think it's just so fascinating. And there are lots of little lessons from this. And I just happen to list a few. Things always feel minor until suddenly they become major. These sorts of events in the markets have a tendency to go on longer and sometimes much longer than expected. I mean, I can't tell you how many people have said to me over the past dozen years, this market rally is getting long in the tooth. I heard that in 2013 and 2015. And, these things go on much, much longer. Humans are stuck in the here and now. The rest of the economic system doesn't have that same bias towards this instance. The future is unknowable. The past is a fuzzy, often misleading memory. All you have is the intersection between here and now. And that unique temporal perspective gives us a warped view of how things happen. So,
and that is why you should read and subscribe to The Big Picture, because this is the kind of thing that Barry is writing about. And it's super important and fascinating to kind of calm down and when looking at the financial outlook and look at the past, and as you say, look at the VIX, which studies kind of investor behavior.
Yep.
It's a really good post. I had no idea about that.
Yeah, it's kind of intriguing. And again, most of the time when the VIX peaks, the market makes its bottom the next day. The big exception was 2008-09 when Congress voted against the TARP bailout plan and the market collapsed. And by the end of the week, they voted for it, and the market didn't bottom till 91 days later. That was late October, and then the market bottomed in early March. And you had November, December. What was it? Was that October or November? Whatever it was, the market bottomed some few months after the VIX peaked. And so you can't rely on it on a timing tool, but it certainly can give you some insight as to the state of the sentiment of market participants. And, I'm very much aware of the fact that the economy and the market are two different things. Most of the market is owned by wealthy people, and most of that is by very wealthy people. And for the vast majority of Americans, the stock market go up or down, they don't really care. It doesn't affect them day to day unless the stock market is telling you that we're heading for a deep recession and people are going to be laid off. So the stock market operates as a sentiment indicator for at least half of Americans who have no investment, no 401k, no portfolio, no ownership of corporate America. And that very much affects how they perceive the state of the economy, and it affects their politics.
You write at the end of this blog entry, the bottom line is this: we have no idea how much worse this gets biologically or economically. Once a glimmer of understanding shows, the market is likely to identify it before anyone else.
True.
Be safe.
Yeah, that happens all the time. The market sees things, the collective behavior of all these people with money on the line. There's a tendency to identify changes in the broader economy long before the economists see it. The economists...
Is that a problem morally, that the market sees things and behaves in a certain way? Because when it comes time to start investing in everything, we go back. What are you investing in? Are you investing in the companies and products that are going to make a lot of money, or should you be investing in a different kind of way? Like, is the reaction to it a moral, human-centered reaction, or is it a financial?
Both. It's both. For most of market history, it was strictly the stock market was a place where people who had capital lent or invested or gave or what have you that capital to companies so they can build and grow. They gave it to investors and entrepreneurs and businesses with the expectation of some return on that capital. That's been most of investing history. Starting about, I don't know, I want to call it 40 years ago, beginning with apartheid and the movement that really began in colleges for college endowments to not invest in anything where South Africa was a recipient. That sort of political movement eventually morphed into a variety of quote unquote socially responsible investing. There's Christian investing and there's Muslim investing, and each of those are very, very specific. So if you want to, and then beyond that, there's ESG investing, there's environmental, social, and governance investing. So you could avoid companies that are high carbon. You could avoid companies that don't have any women on their board of directors or as senior managers. That's the governance side. You could avoid companies that make guns. You can avoid companies that pollute or engage in toxic dumping, or I could give you a giant list of things that these various companies do that either offend some people individually or as a collection offend a large swath of investors. And at one point in time, the standard response was just invest your money and make a profit and then take that profit and give it to whatever groups you want. You want to protect animals? You're concerned about free speech? Yeah, you give this to the ACLU, you could give this to the Animal Protection League, but take your profits and do it that way. That attitude has changed to we could create a portfolio that reflects whatever your belief system. There's a concept now called direct indexing that allows you to basically buy the S&P 500 or any index, but tune out the companies you don't want. It's just a technology solution. It's a software solution to something that was just too complicated to do manually in the old days. Now you could say, all right, I don't want to have anything to do with any companies that have unfriendly policies to gay and lesbians or to any lack of marriage equality. You could pull those companies out of your portfolio. And I can give you a list of 100 different things you
and that's
could do.
That's all. Yeah, and that's all something that people should pay attention to. It just seems like, I don't know. I feel like we have a unique opportunity during a pandemic to look at our entire way of life and system and financial markets and try to understand the motives that they have, which are not promoting healthy living. I mean, talking about climate and talking about, another future worst viral pandemic and the idea that we would be able to respond to all of these serious crises better than, just who's going to make money and how to create a more equitable system. And I feel like markets aren't the solution for that most of the time, which is what's being, that's why we don't have enough ventilators right now. That's why we don't have enough beds in hospitals right now, because of markets, because of capitalism.
See, I would say that it's more because that
hospitals can't compete with empty beds.
Yeah, but that's because of the structure. The one post we didn't talk about was American Capitalism is a Joint Venture. It's a fascinating book called Americana that looks at 400 years of American history. And there's something in it to piss off everybody. It's really fascinating. You go through every industry from 1600 forward, whether it was the Mayflower to cotton to slavery to radio to automotives to you name it. And it started out as a joint venture between the private sector and the government. And we tend to forget that. Healthcare is absolutely the case. If you don't have patents, what are you doing with healthcare? The government is the single biggest purchaser of medical supplies, equipment, and services. If we had a more intelligent approach, remember Bush passed Medicaid Section D for prescription drugs and didn't allow the government to negotiate better prices. It's the single dumbest thing.
And he didn't pay for it either.
Well,
it created debt.
I said Bush, so that's a given. But here's the bottom line. When we look at the hospital system, the legal structure is what allows not-for-profit hospitals to take giant profits and pay themselves giant money. A not-for-profit is supposed to be not-for-profit. The government could do it the same way we do libraries and the same way we do firehouses. It doesn't have to be a crazy, this is a for-profit, capitalistic, profit motive is the only thing that matters approach. Other countries have figured this out. We can also.
Of course, exactly. Other countries. But is it too simple and too obviously liberal of me to say, listen, if you're thinking about national defense, and if you want to argue from some constitutional conservative perspective that the Constitution only affords, government money, taxpayer money to be spent on defense, it's the only thing listed that the government should pay for. Okay, fine. I'll give you the argument. Is a pandemic not more threatening to you than Al-Qaeda? Because if it's not, you've been duped. And why wouldn't we have a different set of priorities? Liberals, conservatives, we're all going to be killed by the same thing here. And it's more likely to be heart disease or a pandemic than a terrorist attack. And yet we're spending and wasting so much money on defense as opposed to all of these other countries, for the most part, which are spending on healthcare. I mean, is that too hacky and simple of an argument?
It could be. I mean, really, what I'm saying is it's not just Wall Street. It's Wall Street and the government. It's a joint venture. You have to have both sides coming to some agreement on a policy, coming up with a way of funding it, and then creating the incentives for people to go out and build in that area.
Well, and this should be the incentive. Is a pandemic not going to shake people's civic thinking and ideological perspectives on how we should be spending money and how we should be living to some extent and what our healthcare priorities should be?
It is. And in fact, the pandemic, the chart I sent you earlier shows the odds of the presidential election from one of the prediction markets. Now, I'm not a giant fan of the prediction markets. They sometimes get it right, sometimes get it wrong, and they're better when we're closer to the election. That said, since last year, you saw the Democrats' chance of winning the presidency plummet to about 42%, while the Republicans' chance ran up to about 60%. Arguably, that was a result of the impeachment that basically ended up going nowhere in the Senate and boomerang to the advantage of the president. And this literally, the Democrats bottomed on February 22nd. The Republicans peaked at February 24th. And since then, it's been straight down. Now the Republican odds of winning the presidency is 46%. The Democrats' odds are 57%. That's a giant swing. And that's why I said, for whatever reason, after 3 years of gross incompetency and ineptness, and there's always a tweet. I love that President Trump mocked Obama for having 3 chief of staffs over 8 years. He's had 4 chief of staffs over 3 years. And so those of us who knew the Trump organization, knew him personally, or worked with people or commuted with people who worked with him. I mentioned a lawyer on my train was in the Trump organization. She left very quickly. She was there, and 6 months later, she said, "You people have no clue what you're doing. I can't be surrounded by such incompetence." I'm not exaggerating. Angela, I won't give you her last name, but she was at a major firm. She went to the Trump organization because they threw a lot of money at her. 6 months later, she's at a different law firm. What happened? She goes, "These are the most inept idiots I've ever dealt with in my entire career. And I've dealt with a lot of inept lawyers," was the quote unquote. So for whatever reason, the initial concept of him as a savvy businessman, we know that's not true. As a guy in control and command, arguably not true. As a guy who knows what he's doing, definitely not true. The initial reality TV game show host image that he very skillfully created for himself. And by the way, he is a brilliant marketer, a brilliant messenger, and a very skillful manager of his own image up until the presidency. And it took a long time for people to get over their cognitive dissonance, to get over the fact that they may have cast a vote for somebody who was not what they appeared to be. No one likes to admit they're wrong. But I think his handling of this virus has finally, the scales have fallen from their eyes. And we saw an inkling of this in the 2018 midterm elections. That was a huge, 42-seat swing? That's the most since, the early 70s. That's a giant, giant change. That frustration and anger is now even more widely felt. And when you see these numbers, this flip that you're seeing just since a month ago, 3 weeks ago, that's very telling. If the election was today, I believe he would lose in a landslide.
Wow.
He would lose the Senate. The House would get more seats to the opposing party. And then all the down ballot races would have a major, major effect. November is a long way away. That's why you can't make any hard judgments today. But if this continues for a month or two, I don't think people will be so quick to forget. If this is over in 2 weeks and we're all back to normal, he has a shot to recover. If this goes, and remember, most corona type viruses, the common cold, the flu, they like a much drier. I'm sorry, they don't like the humid. They don't like the humid.
I don't think we know. I don't think we know about that, do we? In terms of the temperature and climate that these viruses.
Well, look at how seasonal it is. The influenza, the cold, tends to be around more in the winter than the summer.
I think it might be different.
So
anyway, we'll soon find out.
But we don't know how this one is.
All right, your phone's ringing. I've taken up too much of your time. I appreciate it. Everybody,
so the
check out.
takeaway is we'll know more in a month or 3, and that'll have a big impact on the economy and the market and politics.
Check out The Big Picture, Ritholtz.com, The Big Picture. That is Barry Ritholtz. Follow him on Twitter, where he is doing a great job, as always, at Ritholtz. Get his book, Bailout Nation. Thank you, my friend. I really appreciate it. So does everybody listening.
My pleasure. Have a great weekend. Stay safe out there.
All right, there you go. That's it. That's episode 63. Dr. Arthur Caplan, Barry Ritholtz. Thank you. Thank you to all of the new folks who have signed up on Patreon and who have increased their subscriptions as well. Really inspiring. I'm going to try to put out content every day. I'm going to try to go live. I am building this community here, and I got all kinds of ideas in my brain. I'm as stressed, as concerned, and as anxious as you are, maybe more because of money. Maybe you've got a salary job. Hopefully you're in a better situation than my wife and I are. But we're all in this together, and I'm with you. I want to hear from you. I want to be friends with you. I want to stay connected to you wherever you are. I want to hear your concerns. Share them with me. We'll do a listener show soon, not every day. I'm going to be working on this from the home studio, and I'll take all the advice and all the input, thoughts, questions, ideas I can as to how I can create an atmosphere, a show, a community that will help me get through the day. Whether it be informative, enlightening, entertaining, let me know. Email me, standupwithpete@gmail.com. Hit me up on Twitter, on Facebook, on Instagram, on YouTube now, youtube.com/standupwithpete. You can listen to the shows there. I'm posting videos there starting tomorrow. We've got the Ted Alexandro video up. I'm putting together a whole show of just stand-up comedians. It's one of my favorites. Check that out at Patreon. And I'll keep talking to you. Hope you'll keep talking to me. Stay safe. Stay sound. Stay strong. Keep your sense of humor. Tell me what you're reading, what you're seeing, what you're feeling, what you're hearing, and we will keep the conversation going. It doesn't end here. Talk to you online. Bye-bye. Thanks for listening. Tell your friends.